Hi everybody, thanks for joining me with another episode to Back to Basics. My name is Donna. I am Dr. Sama's physician assistant. So I just wanted to talk about vitamin D and how important it is, especially because daylight savings time is actually coming up. And we have to kind of learn to appreciate why the vitamin D is actually important for us to kind of at least understand what it can do for our bodies, what it can make us feel, and how important it is to make sure that we have it. So it's actually one of our favorite vitamins, and I just want to let us teach everybody and actually show us on back to basics of how important it is. So with vitamin D, the reason why it's so important is because the majority of our vitamin D is captured from the sunlight, right? We use the sun, it actually gets absorbed in our skin and it gets converted. Once it gets converted to what we call vitamin D3, it goes to our liver. Our liver actually processes it, and it would actually convert to the next step to the kidneys. And this is where it's important. The kidney is important when it comes to us actually converting it to its most activated form, which is 125 dihydroxy, I'm going to butcher it, 125 dihydroxy vitamin D3. And that is actually in charge of us learning to absorb, our body to learn to absorb the calcium that we consume in order for us to take to absorb it and put it into our bones, right? So the biggest thing that there's actually a lot of studies now is that not only is vitamin D so special, it's actually a hormone because it's actually a fat soluble vitamin, and because of that, it actually has all these other functions. It actually helps with our bodies, especially with our immune system. There's actually a lot of studies that have shown that with immunity, that it's directly connected, because a lot of our cells uses vitamin D. It actually has a receptor to capture the vitamin D to actually activate it, turn on the gene expression to help us produce all the fighting cells that we need to lower inflammation. Other things that actually helps that vitamin D we have to appreciate for is actually with our energy production. A lot of times people complain about fatigue, right? The third thing, that the reason why you might need vitamin D is actually even for fatigue, depression. People don't even realize this, that like with mood disorders, that vitamin D is directly connected to it as well. And of course, like I mentioned, the fourth reason is because it helps strengthen our bones and our muscle, because we use the activated form that our kidney converts over to help us put all the calcium that we consume into our bones. So the reasons why that this is really important for us to have, and which I think we're at, what, 1, 2, 3, we're at our fourth point of reasons why we need vitamin D, and it's because as we are working longer hours, as we are commuting, as we are actually working more at home, we don't really get outside a lot. And because the majority of our vitamin D is from sun exposure, we're limiting ourselves. There's a lot of times, there's also complexion that also makes a difference on why we're deficient as well, is because of our skin color. So people who have fair skin actually can absorb vitamin D a lot more than darker skin. So people with darker skin have more melanin on them, and that's actually a way, I think it's back in the old days, this is our ancestral way for us to protect ourselves from being exposed to too much sun, the harmful rays to cause cancer, and this is the way for them to prevent. But now we kind of understand, since we are inside more, that we're not going to be getting more sun, then they're going to be a lot more deficient. And so people who have darker skin tone actually will require a lot more vitamin D supplementation or maintenance, or they actually should get tested and make sure they are at the right dose. The most important thing, which I'm going to highlight, is because as part of our natural gut relief, people who have chronic gut issues are going to be prone to vitamin D. And this is going back to, vitamin D is a fat-soluble vitamin. A lot of times, if you've had your gallbladder removed, or if you had bariatric surgery, or if you're suffering from malabsorption issues or diseases like celiac disease or Crohn's disease, you're going to be a lot more prone to vitamin D deficiency, just because one, we actually absorb our vitamin D through our gut. And another reason why with reflux can actually be a cause is because if you're on proton pump inhibitors, we're not absorbing the vitamin D as efficiently, right? So this also goes back to the point of, you know, even if we're missing one component, that we're not going to be outside in the sun, we're also not eating enough vitamin D sources, which is going to be in fishes like cod, salmon, sardines, mackerels, and other sources are like dairy products, especially because they fortify it, meaning like whenever they make milk, they actually add additional vitamins into it just so that we can consume it, because they know that we're not meeting it adequately in other sources. So if you have to be dairy free because you're lactose intolerant, or you're on the elimination diet, you actually probably need to make sure that you have a good source of vitamin D in your body, just because to protect you, and also to help with the hormone production that you need for your body. So what are other sources of vitamin D you might need, and what are the doses that you have to consider, right? So if you meet any of the points that I've kind of talked about before, we want to actually talk about supplementation, because we know there's a deficiency. So there's other forms of supplementation. A lot of times people are using capsules. So you see it at your grocery stores, and there's so many doses that you have to consider, right? And a lot of times with dosing, people, when they get their blood work checked, it's usually around the low end of normal. I see this a lot because they're already taking vitamin D, but they're just not where we want them. And really, optimal levels that we see great benefits of vitamin D in your body should be about 50 to 60 in your blood work, right? And a lot of times it takes almost a month with your supplementation to actually see a stable level. So just letting you know, you can't just take it once and that's it. You probably have to be consistent with it, just because it's a fat soluble vitamin and you have to kind of build it up. And usually we recommend getting your vitamin D tested maybe about like in 3 months to kind of see where you're at. The most effective forms, especially if you're suffering from chronic gut issues, is through injection. People don't know this, but if you think about it, it's because it's a fat soluble vitamin, your body would actually keep it as a reservoir, and this is the most effective way because it's actually directly delivered to your system, and it's not having to go to your gut to have to absorb it. You actually have that. It still gets converted to your liver and also your kidney. So that's another good way for us to actually get vitamin D. And I feel like that's the most cost-effective way, if you think about it. A lot of times with the vitamin D supplementations that you get over the counter, is at low doses, like 1,000 units, 2,000 units, but we actually recommend most patients to get at least 5,000 units a day, but you have to make sure you get checked if this is the right doses for you, right? In order for us to get you to the levels where we want you to be, about 50 or 60. So going back to injections, well, who wants to take a pill every single day? Sometimes they actually offer high dose injections that we can deposit in, at least in your deltoid or your gluteal muscle, and that will probably last you a lot longer. Maybe instead of one pill a day, you can go one injection every other week even, but it just really depends on your levels and where you need to be. So if anybody has any questions, just let me know, and you can post in the comments if there's any questions that you'd like for me to answer. But I wanted to kind of at least share, the top 7 reasons why you need vitamin D, especially because we're going into our fall and winter months, and people are getting a lot more cozier inside than outside. So you need a lot more sunlight to convert, but we're a little bit limited, especially during these months of a little bit more darkness. But if anybody wants to know how to, where are they at, you have to ask your family doctor or your GI doctor to make sure they check your levels, especially in the winter months, so then you can get adequate supplementation. The other thing is that if you're interested in getting injections, we recommend having your blood work ready so then we can kind of adjust according to your needs based on your dosing. Oh, Mia says, should I take vitamin D supplements if I will be getting blood work soon? Thank you for asking, Mia. So I still would want you to continue taking your vitamin D just to see if you're actually at the level that we need to be and if we need to discontinue supplementation at the dose that you're at. So I wouldn't discontinue beforehand, and I don't think it makes that big of a difference, especially as we know vitamin D is a fat-soluble vitamin and it stays in your body a lot longer. And like I mentioned, it takes about a whole month for it to even regulate to a stable dose. So that's a good question. But I am... Oh, Dr. Asamoah asked a really good question. There's a lot of studies that vitamin D is preventing cancer, especially colon cancer, and I've seen some studies against breast cancer as well. And so I'll link some articles. I don't want to bore you guys, but just so that we can reference it later. But there are a lot of links because of the immunity response that vitamin D helps regulate with gene expression, that it does help with cancer prevention. So let's see if anyone else has any other questions. But I appreciate you guys joining me for another Back to Basics. I promised that it was short and simple, and I will reference some articles down below just in case that you guys wanted to nerd out and read a little bit more. But I'll be more than happy to kind of at least go over any questions that you guys have down in the comments after some people have gotten a chance to watch the replay. So thank you for watching, guys. Good night.